That moment when you're just like petting your dog or your cat
Yeah.
and you notice something maybe a bit off in their mouth.
Right, like a lump, or maybe their breath smells kind of
Yeah,
bad all of a sudden.
exactly. That little bit of worry. Well, that's where we're jumping in today.
It's totally natural to feel that way. I mean, a pet's mouth can tell you a lot, and any changes are definitely worth checking out.
For sure. And that's why we're doing this deep dive today, focusing specifically on fibrosarcoma of the gingiva.
That's the gums.
Right, gum cancer, essentially, in dogs and cats. We're going to look at what it actually is, how vets figure it out, and, what the options are.
Yeah, and we've been digging into a pretty detailed veterinary source on this.
Right, something that really breaks it down.
Exactly, from the cellular level right up to the signs you might actually see in your pet.
Okay.
So our aim today is really to pull out the key stuff, the crucial info.
And make it understandable.
Precisely. Give you a clear picture of what this condition, gingival fibrosarcoma, is all about.
Okay, let's do it. So, first things first. What exactly is fibrosarcoma? It sounds, well, pretty technical.
It does, yeah. But basically, fibrosarcoma is a kind of cancer. It starts in these specific cells called mesenchymal cells.
Mesenchymal.
Yeah. Think of them as the cells that make collagen.
Ah, collagen, like the structural protein.
Exactly that. It gives tissues their structure. So a fibrosarcoma is a malignant tumor made of these sort of spindle-shaped cells that are busy making collagen.
Okay, malignant. That means it's the bad kind. It can spread.
That's right. Malignant means it has the potential to, invade the tissues around it and even spread elsewhere in the body.
And the spindle cell bit, is that just what they look like?
Yeah, pretty much. Under the microscope, these cancer cells look elongated, spindle-shaped, is one of the things pathologists look for to identify it. And while you might sometimes find it on the lips, or very rarely the tongue,
The main spot is the gums.
the main spot is the gingiva,
Yeah.
the gums.
Okay, that makes sense. So how often does this actually happen? Is it something vets see a lot in dogs and cats?
It's definitely a significant one for both. In dogs, it's actually the third most common type of oral cancer.
Third. Wow.
Yeah, it accounts for like 20% of all the tumors found in dogs' mouths.
1 in 5. Okay, so it's definitely out there.
Absolutely. Which really shows why checking their mouth during regular vet visits is so important.
Makes sense. What about cats? Is it similar for them?
It's actually even more common in cats, relatively speaking. It's the second most common oral cancer in felines.
Really? Second.
Yep. Represents somewhere between, say, 5 and 15% of their oral tumors.
Huh. So maybe even more reason to be vigilant with cats, especially since they can be kind of sneaky about showing illness.
Exactly. Any little change in a cat's mouth is worth investigating.
Okay, good to know. So does it affect certain types of dogs or cats more than others, like specific breeds or maybe older pets?
There are some differences. With dogs, it seems like larger breeds tend to get it more often overall.
Okay, big dog.
Yeah. And interestingly, golden retrievers seem to pop up more often for one particular type or variant of this tumor. We can maybe touch on that again later.
Okay, Goldens and age.
The average age when dogs are diagnosed is around 7 years. But honestly, it can happen at almost any age, seen it in dogs as young as 1 and as old as 16.
So quite a range, but maybe hitting middle age more often, especially in larger breeds and Goldens. What about cats?
Well, the source we looked at didn't point to any specific cat breeds being more at risk.
Oh, okay.
But the average age for diagnosis in cats does tend to be a bit older, around 10 years old.
Yeah.
But again, you see a really wide range, from 1 year up to 21.
Right. So less of a breed thing in cats. Maybe leans a bit older on average. Okay, so the big question for owners. What are the signs? What should you be looking out for at home?
Yeah, this is key. Often the first thing someone notices is just, well, a lump. A visible mass or growth in the pet's mouth.
Just right there on the gum?
Could be. Beyond that, really bad breath that doesn't go away, that's halitosis. Or maybe excessive drooling, hypersalivation. Some pets might seem to have trouble swallowing.
Like dysphagia.
Exactly, dysphagia. Or you might actually see some bloody discharge from the mouth.
Yikes. Those all sound pretty worrying. What about behavior changes?
Definitely. Pain in the mouth can show up in different ways. Maybe the pet suddenly doesn't like its head being touched, especially near the mouth.
Head shyness, right.
Yeah. Or you might notice they're not eating as much, even if they seem hungry at first. Like they go to the bowl but then back off.
Because it hurts to chew.
Precisely. Associates eating with pain.
Okay, those are really useful things to watch for. Now, what about when you get to the vet? What might they find during the exam?
Well, the vet will do a careful oral exam. They'll likely feel a mass that's usually firm, maybe smooth.
Okay.
The gum tissue over it might look normal, but if the tumor's bigger, it can get traumatized or ulcerated just from rubbing against teeth.
Makes sense.
And yeah, that bad breath, the drooling we mentioned, those might be obvious during the exam too.
Any other physical clues?
For sure. They'll check if the pet seems to have pain or difficulty opening its mouth fully. In really advanced cases, you might even see a change in the shape of the face.
Wow.
And they'll definitely feel the lymph nodes under the jaw on the same side as the tumor.
The ipsilateral mandibular lymph node.
That's the one. Feeling for any swelling, which could mean it's spread.
Okay.
Oh, and if the tumor's in the upper jaw, the maxilla, they might look for signs like nasal discharge, maybe nosebleeds, or even check if airflow through the nostril on that side seems blocked.
So it's a really thorough check of the whole head, essentially.
Absolutely, it has to be.
Okay. Now, the million-dollar question. What causes this? Do we know of any risk factors?
That's one of the frustrating parts, actually. Based on the information we have, there are no specific causes or risk factors that have been clearly identified for gingival fibrosarcoma. Not in dogs, not in cats.
Huh. So it's not like, say, sun exposure for some skin cancers or anything like that?
Apparently not. Nothing definitive has been pinned down yet.
Okay. So if the cause is unknown and you see some of these signs, how does the vet figure out if it is fibrosarcoma versus something else? What else could look similar?
Right, that's the differential diagnosis stage. The vet has to consider other possibilities. There are other kinds of oral tumors like melanoma or squamous cell carcinoma or different types of epilous growths.
Which can be benign or malignant, right?
Some can be, yeah. And then there are non-cancerous things too, like a bad tooth root abscess or a bone infection, osteomyelitis, even things like dentigerous cysts or a condition called craniomandibular osteopathy, especially in younger dogs.
Wow. Okay, so quite a list to roll out.
Definitely. They all need different approaches, so getting the right diagnosis is critical.
So what tests help narrow it down and confirm fibrosarcoma?
Well, standard blood tests and urinalysis are usually done first, but honestly, they're often normal with this specific condition.
Okay, so blood work might not tell you much here.
Not directly about the tumor itself, usually. Imaging becomes really important. Skull x-rays, or even better, dental x-rays, are definitely recommended.
To see if the bone is involved.
Exactly. We need to know if the tumor is invading the underlying bone, which happens pretty often, like 60 to 70% of cases.
Okay, so x-rays give a baseline look at the bone. Is there anything more advanced?
Yes, CT scans. A CT gives much more detail about how far the tumor extends locally.
Ah, like a 3D picture.
Sort of, yeah. It's incredibly helpful for planning treatments like surgery or radiation, especially if the tumor is up in the maxilla, the upper jaw, or if it's really large, or way in the back of the lower jaw.
Right, helps plan the attack, so to speak.
Precisely.
So imaging shows the where and how big, but how do you know for sure what it is, that it's definitely fibrosarcoma?
The only way to get a definitive diagnosis is with a tissue sample, a biopsy.
Taking a piece of the tumor itself.
Right. That piece goes to a veterinary pathologist who looks at it under the microscope. That's called histopathology. And while they're doing that, it's also strongly recommended to sample that nearby lymph node we talked about, the mandibular one.
To check if it's spread there.
Exactly.
Yeah.
You can do that with a needle aspirate for cytology, or sometimes a biopsy of the node itself, checking for metastasis.
Got it. So biopsy is the gold standard for diagnosis. Now, you mentioned earlier something about some of these tumors being tricky. Deceptive.
Ah, yes. This is a really fascinating and frankly challenging aspect. There's this type of fibrosarcoma, seen particularly often in golden retrievers, but also other large dogs, where under the microscope, the tumor cells can look, well, not that bad, relatively bland, what pathologists call low grade.
So it looks kind of benign almost.
It can, yeah. The cells might not scream aggressive cancer when you look at them initially.
And they act aggressively.
That's the kicker. Despite looking low-grade microscopically, these tumors can be incredibly invasive locally. They destroy bone in about 75% of cases.
Wow.
And they can spread. About 20% spread to the lymph nodes, and around 12% even go to the lungs.
So the looks are deceiving.
Very much so. Because they look less aggressive initially, they might sometimes be mistaken for something non-cancerous, like nodular fasciitis or just chronic inflammation. Or they might get called a very low-grade fibrosarcoma at first.
Which could lead to maybe undertreating it initially?
Potentially, yeah. It really highlights that histology, what it looks like under the microscope, doesn't always perfectly predict the biological behavior. You need the whole picture.
That's a huge point. Okay, so let's say the diagnosis is confirmed, gingival fibrosarcoma. What are the treatment options? What's the main approach
The primary recommendation, the cornerstone, is usually surgery.
to remove it?
Right. And the goal is aggressive removal. Not just the tumor mass, but also a chunk of the adjacent bone. That's the maxillectomy for the upper jaw or mandibulectomy for the lower jaw.
Why take bone if the tumor's just on the gum?
Because these tumors are often locally invasive, remember, especially into bone. So taking surrounding bone is crucial for trying to get it all. The aim is for wide margins. Ideally, at least 2 to 3 centimeters of apparently healthy tissue all around the visible tumor, including bone.
Okay, that sounds like pretty major surgery.
It can be, definitely.
Then what if? What if the surgeon can't get those wide margins? Maybe the tumor's in a really awkward spot.
That happens. If the surgery results in incomplete margins, meaning there might be microscopic cancer cells left behind, then radiation therapy is often the next recommendation.
To zap any leftover cells.
Essentially, yes. It's called adjuvant therapy. It helps improve local control, trying to stop the tumor from growing back in that spot.
Okay. And what if surgery just isn't an option at all? Maybe the pet is too old or sick, or the tumor's just too big or invasive.
In those cases, radiation therapy could be considered as the main local treatment instead of surgery. And of course, palliative care is always important.
Focusing on comfort.
Exactly. Managing pain, ensuring quality of life, regardless of whether you're pursuing curative intent treatments or not.
Right. And speaking of pain management, what kinds of medications are typically used?
NSAIDs, nonsteroidal anti-inflammatory drugs, are very common for managing pain and inflammation.
Like carprofen or meloxicam?
Those are common examples, yes.
Right.
Then there are other pain meds too, like tramadol.
How is that given?
Usually by mouth, maybe every 6 to 12 hours. The dose is typically around 2 to 5 milligrams per kilogram of body weight. Gabapentin is another one that's used a lot for chronic or nerve-related pain.
Gabapentin, okay. Dose for that.
Also oral, usually every 8 to 24 hours at about 3 to 10 milligrams per kilogram. And sometimes if there's an infection on top of the tumor, maybe from ulceration.
Antibiotics might be needed.
Correct, to deal with any secondary bacterial infection.
Good to know there are options for pain. Are there any big warnings with these meds?
Yes, definitely. With NSAIDs, you have to be cautious. Especially in cats, they metabolize them differently, and also in any dog that already has kidney issues.
Because NSAIDs can affect the kidneys.
They can, yeah. So the vet will weigh the risks and benefits and monitor things closely. It's always about tailoring the plan to the individual pet.
Makes total sense. Okay, so the pet gets treatment, surgery, maybe radiation. What happens next? What's the follow-up like, and what's the overall prognosis?
Follow-up is really crucial. You can't just treat it and forget it. Vets will typically want to recheck the pet pretty regularly.
How often?
Usually a physical exam, including checking the mouth carefully every 2 to 3 months.
Okay.
And they'll also likely recommend chest x-rays periodically, maybe every 3 to 4 months.
To check for spread to the lungs.
Exactly. Monitoring for metastasis, which most commonly goes to the lungs or those regional lymph nodes.
Right. And what's the hard truth about the prognosis? How well do pets generally do long-term?
It's a serious diagnosis. The reality is that many pets diagnosed with this will eventually either pass away from the disease growing back locally or be euthanized because of it.
Even with treatment?
Even with treatment, yes. The overall chance of it spreading elsewhere, metastasizing, is around 20 to 30%.
So local recurrence is the bigger issue for most.
Often, yes, though metastasis is still a significant risk.
Does the outcome vary much, like depending on the treatment or the tumor?
It does vary quite a bit. If you just do surgery, the survival time reported really depends on things like how big the tumor was, where it was, and crucially, whether they got those clean, wide margins.
Right.
Median survival time, sort of the midpoint range, anywhere from about 9 months up to 24 months. But if they achieve complete removal, long-term control, even cure, is actually possible in some cases.
Okay, so complete surgery is key. What about combining surgery and radiation if the margins weren't clean?
When you have incomplete surgery followed by radiation, the reported median survival time is around 18 months.
18 months, okay. And radiation alone, if surgery isn't done?
With radiation as the only treatment, the results seem heavily dependent on the tumor size.
How so?
For smaller tumors, less than 2 centimeters, the median time before the disease progresses again can be surprisingly long, around 45 months.
Wow, that's almost 4 years.
Yeah, for small ones treated with radiation alone. But for medium ones, 2 to 4 centimeters, it drops to about 31 months. And for the big ones, over 4 centimeters.
Much worse.
Unfortunately, yes. The median progression-free time is only about 7 months. Size really matters there.
That's a huge difference based on size. What about for cats? Is the info similar?
There's actually less specific data published for cats with this condition. But the general feeling is that the prognosis is probably less favorable overall.
Why is that?
Mostly because achieving those wide, complete surgical margins is often much more challenging in the smaller, more delicate structure of a cat's mouth and jaw.
Okay. That makes sense. So it really brings it back to catching it early, doesn't it?
Absolutely. Early detection means the tumor is likely smaller, which improves the chances of successful surgery, potentially better response to radiation if needed, and just generally offers more options and a better outlook.
Okay. So wrapping this up, the big picture here from our deep dive is that this gum cancer, gingival fibrosarcoma, is a really serious thing in both dogs and cats. Its behavior can vary, some types are sneaky, and the outcome depends a lot on early, aggressive treatment.
That sums it up well. The best shot at control comes from catching it early and going after it decisively, usually with surgery, aiming for wide margins.
So, the message for listeners is clear. If you see any of those signs we talked about, the lump, the bad breath, drooling, trouble eating, don't wait.
Please don't wait. Get your pet to the vet for a proper checkup right away.
Absolutely. And just, a final thought to leave people with. Considering that point you made about some of these tumors looking low grade under the microscope but acting really aggressively,
Yeah.
what does that really tell us about how complex cancer diagnosis is? It's not always straightforward, is it? It really drives home that you need more than just a quick look. You need that thorough investigation to figure out what you're truly dealing with.
It's a perfect example of that. Biology is complex, and cancer is especially tricky. Looks can absolutely be deceiving.